Oncologists and oncology practices do a great job of taking care of patients. But the things that I saw falling through the cracks in like 1996 when I started my fellowship are the same things in a lot of ways that are happening today.
Cancer care is one of the areas where costs are growing the very fastest across all different segments of the healthcare ecosystem. And for health insurance companies, they're on the one hand looking for solutions that can help try to control the costs. On the same time, they're looking to figure out how can they actually have better experiences for members who are going through cancer care. And at Thyme Care, we feel like we've created a solution that can actually do both of those.
Thyme Care partners with health plans and providers to improve the patient experience and drive better outcomes for people living with and being treated for cancer.
The backbone of our care model is patient-centered, patient-oriented navigation, and it's a combination of community health workers, lean navigators, as well as nursing personnel. And we have folks who have a background in oncology, but also other longitudinal primary care, nurse practitioners, all overseen by a medical director.
You always have somebody to call. You need help with transportation to your doctor. There is someone who can help you with that. You are having a new symptom. It is 8 p.m. on a Friday. There is someone you can trust who you can talk to about that symptom, understand how serious it is. Does it need to be escalated to an emergency department? Is there a medication you already have at home that you could take? Thyme Care is there to provide all of those tools and resources to our members and their caregivers.
What Thyme Care is able to do is be sort of at the hip of these patients at all times. That model, I think, is extremely unique. Care navigation and proactive symptom monitoring can oftentimes be as impactful or more impactful than the amazing drugs that we're bringing to bear today.
We're primarily focused on how do we drive higher quality and how do we drive quality that also has the effect of reducing cost. So whether that means keeping people out of the hospital, keeping people out of the emergency department, better care at the end of life, or making high-value drug decisions that still drive the same patient outcomes, those are all the things that we focus on in the oncology space. That's not something that anyone else right now is doing.